It's a day with your fertility specialist. Yeah, thank God it's Friday. Everyone is excited about Friday. Okay, so on behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying glued to your screen. As we get started right now, please share this link with someone. Yes, and it's a good thing that today's question and answers. So we're here to attend to every of your concerns. Just do us the favor of dropping your questions in the comment sections, your opinion, and we are live here to attend to them. And guess who we have with us? We have a big shot. Yeah, we have Dr. Kenneth Eguda. For the sake of someone watching for the first time, Dr. Kenneth Eguda is a consultant gynecologist. He's a fertility specialist. Yeah, one of the best IVF specialists you can ever know. He's also a minimal access surgeon. One, I think the first in West Africa to carry out laser gynecological surgery. So that's a big plus. And you can imagine having him in person right now with us today. So, all your questions, he's here to attend to them. Dr. Ken, it's good to have you on set.
Yeah, I've been away for a while.
Oh, yeah,
I'm
welcome back.
glad to be back.
And I'm sure our viewers are happy to see you. So once again, viewers, please share this link and call up someone so they're able to join and keep your questions rolling while we attend to the few that some people have already dropped. We expect to see more of yours coming in. Okay, so Dr. Ken, a lot of questions for you today. So one of the questions we have says, what aid can be given to boost the lining of the womb?
Boost the lining of the womb.
Yeah.
The lining of the womb is actually a very important aspect that could determine whether or not pregnancy outcome will be fine. I mean, IVF would be positive or not.
Yeah.
So, and the things that affect the lining of the womb are usually scars that could come from D&C or from surgical
Oh, wow.
procedures, which could be fibroid surgeries, even cesarean section,
Section.
or
Wow.
infection,
Hmm.
pelvic inflammatory diseases.
Diseases. Wow.
And inflammation in the lining of the womb. So the common things is that the adhesions, the scars, which could either be from surgeries or
All
infection,
that you've
could
mentioned.
thin out the lining of the womb.
Yeah.
And then if the lining of the womb is thin or is full of scars, then pregnancy prospect becomes very, very
No. So.
low. So in the first thing, you have to understand what is making the lining of the womb to
Not
need
actually.
boosting according to the question.
Yeah.
So this individual will need a hysteroscopy first, and then if the lining of the womb seems to be having some scar tissues, then it could be addressed using the hysteroscope.
Okay.
And if the lining of the womb has been traumatized either by infection or by surgical procedure up to the junctional layer of the uterus,
Yeah.
then you're dealing with some problems.
Wow.
Then one of the things that could be done is to do endometrial rejuvenation
Oh,
using
wow.
the platelet-rich plasma,
Plasma. Wow.
or
Okay.
exosome, or precursors to stem cells
Wow.
through the hysteroscope. You just inject onto the lining of the
Of the
womb
womb.
these
Okay.
items or these materials. Then the lining of the womb can grow afresh again. you know so
Wow. It's
those are
nice.
some of the things that can be done. Then the other things is to give adequate hormone support during
Okay.
the IVF treatment process, maybe a little higher dose than the regular.
Okay.
Yeah,
That
and
could.
that's just it.
That
Then some years back there was possibility of inserting sildenafil citrate, which is
okay.
what the laymen call, I mean, what, not laymen now, sorry, what they call Viagra.
Viagra.
And it's
That's the common name.
the brand name, market name.
Yes.
There's a vaginal preparation.
Okay.
It helps to supply blood to
Okay.
the uterus, lining of the woman, and it can grow easily.
Wow.
And
Okay.
so those are some things that can be done.
Okay.
Yeah.
So hope this answers your question. He has said a lot, like he has really said a lot. But now he's saying not it's not for you to just stay on your own and be prescribing one
For
thing for yourself.
yourself,
You know, you need to see
the
your fertility
gynecologist.
specialist, yes, so they're able to give you what's best for you and
Yeah.
not for you to say, okay, this is what you do and this is what
Hmm.
you do.
Hmm.
Trust them to give you what's best for you. Okay, and then another question: does your hospital screen for chromosomal abnormalities?
Yeah, if the need arises, we'll do that.
Okay,
I want to assume the person is trying to ask about pre-implantation genetic
genetic
diagnosis, because
testing.
that's the only
Hmm.
time where genetic abnormalities or
Antigen
chromosomal
are
abnormalities are
checked.
screened for, and in addition to the health of the baby
Baby.
generally.
Hmm.
So yeah, in this case, after we've generated the embryos,
Hmm.
we take a little part of the
Of it.
embryos that is safe to be taken
Hmm.
and subject it to gene amplification and
Yeah.
analysis. So that way you see whether there are abnormalities with the genes like
Hmm.
trisomy 13, trisomy
Hmm.
18, and all of that, Down syndromes, and
Yeah.
other genetic abnormalities. You see,
Hmm.
so we screen for all of that when
Hmm.
the need arises, and
Raises
that's the only time actually you can make a very good
proper.
decision
Hmm.
on whether the embryos are fine or
Or
not,
not.
because
Hmm.
the main cause of failures of IVF, before other things, is genetic abnormalities.
Nice.
So
Wow.
that's why you
Hmm.
could transfer blastocysts of best quality to the
Hmm.
best quality of endometrium,
Yeah.
all other things being equal, and then pregnancy is
Pregnancy
not
doesn't
forthcoming.
happen.
Genetic
Hmm.
abnormalities may be responsible. So yes,
Wow.
we do all of that.
Hmm.
Do
So
all of
for
that.
this person that asked this question, I'm sure if you go through ALP's profile, you'll see a lot of talks about pre-implantation genetic testing, and
Sure.
that would help you to see all the information you need to know, and it's also guide you on how you can best access that service from ALPS
There
hospitals.
were times that you have, well, in Africa and in a lot of other parts of the world,
Yeah.
Asia and all of that, you have
Mm.
people either secretly or openly requesting for gender selection, whether the
Yeah.
female gender or the male
Mm.
gender. People request for what they
For
want to
it.
request
Yeah.
for. And then you do all of that pre-implantation genetic diagnosis. You'll be surprised that you may have up to 5 males in the
Mm.
treatment,
Yeah.
and up to 3 or 5 of them are
And
abnormal.
wow. Ooh.
You understand? So it helps you to tell whether these embryos have prospects,
Prospect. Wow.
whether they are normal, and whether they have prospects of being
Hmm.
pregnant, becoming pregnancy if every other thing is okay.
Hmm.
You understand? So it's a good thing to do, but whether we could get to the point of doing it for everyone is what I think it's going to be practically impossible,
Hmm.
because
It's
someone
not cheap
has to pay the
for
bills,
it.
and it's not a
Yes, it's
small
not
bill
cheap
to
to
pay.
do.
Yeah.
Yeah, it's not cheap to do, but it's accessible. You can actually access it, and it can be
Mm.
done for you. Okay, and then so someone also asked, does freezing eggs, sperm, or embryos have an impact on the outcome of pregnancy?
Oh, well, if freezing is done properly
Hmm.
and the embryos are normal embryos,
Yeah,
before frozen or before freezing,
yeah.
it doesn't have a negative impact.
Impact.
I would
Hmm.
rather say it has positive impact,
Impact.
because the body language is that for a fresh IVF treatment cycle, you could have some unnecessarily abnormal hormones
Hormones.
levels
Hmm.
that could hinder the prospect of having immediate pregnancy. So
Yeah.
when you freeze the embryos that are okay, that are normal,
Hmm.
or eggs,
Yeah.
and then you're transferring on a fresh treatment cycle where you didn't stimulate the woman to produce eggs,
Yeah.
then the chances of getting pregnant is high.
Pregnant.
But
Wow.
if you freeze the poor embryos shouldn't be frozen,
Hmm.
because their prospect of surviving is poor,
Oh.
and
Hmm.
more likely they may not even become pregnant. The
Pregnancy.
same thing happens with sperms. If sperms
Hmm.
are not of good quality and you freeze them, some may not survive the freezing
Freezing.
process.
Hmm.
You're freezing sick sperms, they wake up sicker.
Sika.
Oh yeah,
Hmm.
yeah, we see them a lot of times. You
Hmm.
freeze them, and the embryologist will not be so happy about that.
Hmm. Yeah.
But if the sperms are okay, and you freeze them, they have high rate of survival, and they can be frozen to any length of
And
time.
mm. I mean, one of your head of embryology actually talked a lot about freezing on Wednesday.
Okay.
So I know that for this person that asked this question, I mean, you can always watch because I know he said a lot about how embryos, sperm, and eggs should be
Mhm.
before they are frozen. And I
Mhm.
know for the past 2 weeks, Alps has been talking about fertility preservation, and
Oh
a
yeah.
lot
Yeah,
has been
yeah.
spoken
Mhm.
about how sperm should be, how eggs should be, and how embryos should be before they are frozen. So it means that they should be in their best states to hope for the best when they're eventually towing them. And like he has said, you would have pregnancy outcome once they are good and as in good enough for freezing. Hopefully,
Mhm.
even though all good embryos don't result to pregnancy,
Oh
so
sure.
you
Yeah.
cannot say it's
Yeah.
because it
Yeah.
was frozen. That's why it didn't
Exactly.
succeed.
Exactly.
Okay, so hope that answers your question. Someone also asked, "Can I travel after 2 hours of embryo transfer?"
Mm. Yeah. Yeah. You can travel
Hmm.
if you have to travel. Why not? You can travel. 2 hours. That's some sufficient rest there. Now by what means and what kind of circumstances, you
Hmm.
know traveling in a road that is ridden with gullies and
Hmm.
valleys, potholes,
Yeah.
and all of that could just increase your stress level, and then we
Mm,
don't watch so much stress
stress
after embryo transfer. But if you're
transfer.
flying, by all means keep flying. You can fly for any amount of hours. You can fly for any length of time.
Hmm.
Especially if you're flying in a business class.
Oh yeah, yeah, chilling.
You're chilling and they're taking care of you.
Yeah.
But after embryo transfer, the main thing is just to have a relaxed mood, but
Good.
not to stay put in
In
one
one place.
place.
I think you
Because the
should talk a
staying
lot
the
about
staying
that.
put in one place is actually a counterproductive moves,
Hmm.
because it restricts circulation,
Okay.
and you
Hmm.
need good circulation, and for the embryos to get implantation to
Hmm.
get
Viewers,
implanted, and
hope you are
then
hearing.
pregnancy happens.
Hmm.
So women just have this notion, or couples have this notion that you've just done a very big thing, and so because of that, just stay
Stay in one
put,
place.
lie on your back,
Hmm.
facing up, and never turn. No cream your body, don't do all of
And
that
all
and all of
that.
that. You
Hmm.
just punishment. you know
Yeah, punishment.
Exactly. So move around, be in a relaxed mood, be in a happy mood, do your regular activities,
Hmm.
and think less if you can, distract yourself,
Yeah.
and then expect pregnancy.
Because some of them will say, "Can I go to the office?" You mean I can go to the
Oh,
office?
yeah, you can go to
And
the
you're
office. It depends on
wondering,
the kind of work you're
you
doing.
do. Mm.
Yeah, you can go to the office. Don't
So,
work, against your normal energy. You cannot
yeah.
work against normal energy.
So, viewers, there's one thing I caught from what Dr. Ken was saying. He said, distract yourself because sometimes some of them just stay one place and
Mm.
then their mind is just focused. And then they'll usually say 2 weeks, the longest wait of
Hmm.
their life. So, imagine
You have to
that you
distract
are not
yourself.
doing
Yeah.
anything, you just stay put. I mean, it doesn't increase your chance or
Hmm.
lessen your
Hmm.
chance in any
Do some
way.
fun things.
I mean, just keep yourself happy.
Hmm.
Keep yourself happy and happy and be active.
Go
But
to church and praise God.
oh yeah, yeah,
Not shout
whatever
too
makes.
much.
Oh my goodness. But yes, we can actually relate with some of these women sometimes when you see them doing these things because some of them might have actually been through a lot. But all we are trying to say is yes, as much as some of these things you do is because you feel like, okay, the last time I did this and it did not succeed, so maybe I should try this. Still, please be active and be happy. Like
Mhm.
keep yourself a bit busy and don't just stay one place.
Mm.
Why we hope for the best, that as you're also wishing for it to succeed, that we hope that success meets with you and you achieve pregnancy. Okay, so we also have a question coming. Can all fibroids be removed through laser?
That's a very technical question.
Question. Mm,
In the first place, I would say laser is very versatile.
mm,
You know, very very versatile. Depending on the thickness and the strength of the laser fiber you have, you
okay.
could actually remove most fibroids.
Okay.
And then if it refuses to be removed, you could myolize it.
Okay.
There are laser fibers that have capacity to myolize fibroids.
Fibroids.
Okay,
Wow.
just so it vaporizes it.
Mm, wow.
So some have that capacity. So, and then if you also consider that laser can be used hysteroscopically and laparoscopically.
Yeah.
You will now say yes, all fibroids can be removed
Remove
using the laser,
laser
either hysteroscopically or
or
laparoscopy. And you know what?
laparoscopically.
Even open surgery,
Hmm.
open myomectomy or
Yes.
laparotomy, you could use the laser,
Hmm.
to remove those fibroids. And
Wow.
what benefit does it actually have?
Hmm.
Now, use of energy for operation. Laser energy has no spread. If at all it spreads 1 millimeter to either side
Hmm.
of the cord, is what you have. Because when you're using energy to operate, you're actually compromising the
The
the the the,
supply.
si- I mean the structures.
Hmm.
I mean, just
Around that
close to
place.
it.
Yeah.
Like if you cut with diatomy, which is
Yeah.
electricity, for instance, you could have some damage 5 millimeters
Hmm.
on this side, 5 millimeters on
On
the
the
other
other
side.
side.
In which
Okay.
case, the tissues close to the cut area get devitalized to an extent.
Hmm.
Okay, and these are the things that cause the morbidity. And then you finish a good surgery, and then you're not seeing what positive outcome you're expecting. So laser doesn't do that.
Hmm.
It preserves tissue, and laser
Hmm.
has a regenerative effect on tissues
Wow.
because it helps collagen formation,
Mm-hmm.
helps neovascularization, and
Wow.
so it's
Hmm.
superior,
Hmm.
to any energy that's available currently.
Wow. Hmm.
So with respect to cutting and operation, so
Yeah.
you can use that to remove most fibroid. You can make your cut around the fibroids and enucleate the fibroid.
Hmm.
Healing is better, faster, and less complication
Complicated.
when laser is used compared to any other energy. So if you ask me what's the best choice of energy for operation, not because I'm a laser gynecological surgeon, but because that's what laser is. I just finished a hysteroscopic myomectomy,
Okay. Hmm.
yeah, just before coming.
Wow.
Yes, and that is
Straight from the theater.
partly why I was a bit late.
Later. Hmm.
So laser is just a beauty. Yes. So most fibroids, all fibroids, can be operated using the laser, laparoscopically, hysteroscopically, or open laparotomy myomectomy. So you can
Okay.
use a laser. Yes, that is just it.
Okay, so for you to ask this question, hope that clears your question.
Mm.
But once again, like I would say, please make sure you see your fertility specialist and let thorough examination be
And one
done.
more thing,
Mm.
while it is cutting the laser, it seals blood vessels, so you
Hmm.
don't have bleeding.
Bleed.
Because when you're cutting
Oh.
a structure, you're cutting, and you may cut through blood vessels. The laser cuts,
Hmm.
uh, it seals the blood vessels,
Oh
and
wow.
also help in neovascularization.
So much for
So there's
one
just so
gadget.
much for one energy source,
Yeah.
and it can actually be very addictive
Hmm.
if you get yourself
So
using
involved with it.
laser.
Hmm.
Yeah,
Okay. So well this person says she's from Uganda, she's 35, but she has PCOS and she misses her period. So she's like, I need your help, sir. Well, I don't know how much help you can prefer, but what would be your counsel to her? She says she has PCOS and she misses her period.
this is not adequate history. If I was a woman, or I'm a woman, and I miss my period, I think I'm going to be happy.
Oh, the discomfort that comes with period.
Knowing what I know about period, if I
Hmm.
just miss it, I'm going to be happy. If it's pregnancy, it's different.
Yeah.
Yeah, if it's pregnancy, is different. But in any case, if missing period is what the problem is, we need to find out what her desires are. Because what
Hmm.
you do to PCOS clients or individuals depends on what their
They
needs
actually
are
need
at every point in
in
time.
time.
You know, so we don't know if she plans getting married, or whether her period comes and it gets so heavy, or whether period just goes away for 6 months, 3 months, and all of that, or whether the quality of eggs are good or bad, or whether fertility is also a concern here. So it's going to be very
Hmm.
difficult dealing with this question. But in any case, if she misses the period and you just want to see the period, there are medications to give to induce the period.
Period to
But of
come.
course, if you want to go beyond medication, you could do ovarian drilling,
Okay.
laparoscopic ovarian drilling.
Hmm.
I just did one also this morning.
Oh wow, so much for today.
Yes, if I was being a busy day, I've just done one this morning. When you do laparoscopic ovarian drilling, for instance, in addition to improving your chance of having regular ovulation, reducing the androgens in the
Hmm.
body that cause poor eggs and all of that.
Yeah.
You also improve the menstrual regularity of the patient, of the individual. So just
Wow.
one intervention having multiple benefits.
Benefits.
So
Yeah.
that can actually be important for her. And of course, it makes pregnancy prospects a lot easier,
Yeah.
you
Oh,
know, because
wow.
you see, this PCOS usually have four different grades:
Great.
phenotype A, phenotype B, C, and D. C and D phenotypes are usually very notorious kind of PCO to deal with. A, B, fair to manage, you know.
Oh,
So there's just a lot. She needs evaluation,
nation.
and what
Exactly.
will be done for her depends on what she needs.
So for our Ugandan lady, please, I think your question shouldn't just end here. You could actually book an online consultation with the number being displayed on the screen so that you're able to get proper counsel and proper attention and maybe plan a better way forward aside just the questions or the address that's been given to your concern here. So we have another question asking if a woman could conceive spontaneously after undergoing IVF treatment previously.
Sure, we've seen quite a number of women conceive spontaneously if every condition becomes normal or it's
Normal.
normal. Okay, for some people, the problems before even IVF is done is anovulation,
Oh,
and when
okay.
you've given them this series of medication for
Medications.
for IVF treatments, somehow it realigns the ovarian pituitary axis.
Okay.
You understand? And then things may happen well from that point, and then
Wow.
spontaneously they could ovulate and then get pregnant.
Pregnant.
But if the
Okay.
reason for the IVF is blocked fallopian tubes
Tubes.
or removed fallopian tubes, you can't get pregnant spontaneously. So it all depends on what's causing the subfertility or infertility, you
Fertility.
know, and then whatever it is. But quite a number of people have succeeded. They've gotten pregnant spontaneously
Continuously.
after failed IVF
IVF.
treatment cycle.
Wow.
Yeah.
So it means someone could actually, like I said, all conditions have to be
Mm.
favorable
Oh
to
yeah.
actually achieve
Mhm.
spontaneous pregnancy. And then, well, this person is talking about adenomyosis. She said, can a woman with adenomyosis conceive through IVF that she's 44?
Yes, with adenomyosis, we can conceive, you know, through IVF. It all depends on the extent of the adenomyosis. You
Okay.
know, if you're dealing with a very global adenomyosis with junctional layer affectation, for instance, chances of achieving pregnancy is
Pregnancy.
poor. You understand? But if it's a focal adenomyosis, for instance, your chances are higher,
Hi. Oh,
you know,
wow.
because just restricted to an aspect. And of course, use of medication to control or suppress adenomyotic
Growth.
cysts or glands before IVF is done is another option. But of course,
Okay.
there's also room for surgery, debulking the adenomyotic uterus, you know, coring surgery to improve on chances. But adenomyosis is one thing I actually don't like seeing
Same.
because it's always very notorious.
Wow.
It takes the woman through a lot, you know. And
Okay, and then this person, okay, this one is asking, what role do hormones play in male and female fertility? Because I think sometimes they wonder why they are asked to do some of these hormone tests. And they're like, so I think when you start calling this, when they start saying pay for this hormone test, and they're like, why do I have to do this test? And
in
also,
the first place, fertility is all about hormones,
mm,
and every level of the hormone, you know, speaks to a certain prospect with fertility.
okay,
Yes. Now, if the hormones are normal, your doctor is happier because why those hormonal tests are done is to see whether you are prospect of producing either sperms or eggs. You know, then it's also good to mention at this point that some of the hormonal analysis that may not be as informative as some other hormonal analysis. FSH, LH, for instance, a woman can be old and FSH and LH are still normal, but AMH can tell what exactly the ovarian reserve is,
yes,
because all of
okay,
this will guide the doctor in selecting the modality of treatment you should
treatment,
have, or if you choose to use the word protocols, because different hormone level, different age requires different kinds of treatment
treatment,
modalities. If you have to individualize
their
their
treatments,
treatment processes. So the hormones are important. They tell about the condition of the ovaries, condition of the sperms, and condition of the body whether there
Okay.
are whether pregnancy prospect or pregnancy process will go smoothly, like thyroid hormone, for instance.
Hmm.
If it's not okay, even though it's not a direct uh, fertility hormone, it
Yes.
plays a role in pregnancy, even on
Pregnancy.
the process of ovulation.
Hmm.
You know,
Wow.
if thyroid hormones, the hormones are low, pregnancy prospect is poor, you could have miscarriage, you may not even get pregnant. Of
Wow.
course, if it's also high, you have thyroid toxicosis,
Hmm.
it's another problem altogether. You
Again.
may just not even be pregnant or be ovulating with high metabolic states.
Wow.
So all the hormones are important, and that is why the gynecologist will not hesitate to request for your hormone
And
analysis.
analysis. So hope
Even
that.
the lady who asked the previous question whether she wasn't menstruating, she was
Yeah.
PCO, the first investigations that will be done is also hormonal,
Hormonal. Hmm.
because you want to classify what's going on,
Yeah.
so you
So
can know
now.
where to help from.
Hmm. So
Everything is
you
just about
see.
hormones. And
So.
even when women get to menopause, it's still hormonal. It
Hmm.
goes there high up in the
Hmm.
skies, in
Yeah.
hundreds, above the normal
Wow.
range.
Hmm.
It shows that she doesn't have eggs.
Hmm.
There's no need giving her
Trying to
medications to ovulate.
stimulate.
Advise
Yes.
her on the right way to go.
To go. Wow.
Yeah.
So you see that Dr. Ken has mentioned a lot about the role of hormones for both the male and the female. So it's not out of place or it's not outside the box when they tell you as you try to seek
Mm,
fertility help. When they tell you we need to do this hormone test or this hormonal
mhm,
assessments, it's not out of place. That's because it plays a lot of roles. And then even while you're even doing your treatment and they request for some hormone investigation, you also know that it's because they're also doing it in your best interests
mhm.
and not just for their interests. Okay. And then okay, so someone is asking, apart from IVF, which other way can one use to get pregnant? Well,
Yeah, spontaneous pregnancy. There are only two ways to get pregnant. Either you get pregnant spontaneously,
mm,
which is what people call natural pregnancy. I
mm,
don't like the word natural
natural.
pregnancy. It is spontaneous because it
Mm,
just happens.
mm.
IVF is also natural pregnancy because the eggs and the sperms are natural,
Right,
just that
exactly.
it is aided,
Mm.
assisted.
Instead,
So one
yeah.
is unaided, it's spontaneous, then the
Yes.
other is assisted or aided. They're all natural. So if you don't get pregnant by IVF, the other way is to get pregnant all by yourself, unaided.
Okay, so I think what this person is trying to, yeah, for instance, maybe battling with fertility and they're not thinking IVF route.
Okay.
So maybe what other ways, what other options do they have if not the IVF route? I think
Mm,
that's the angle that this person is asking from.
okay.
So I'm just wondering, is there anything that they could do? Are there other things that you'd recommend for someone that's been struggling with fertility and okay, maybe people have done some investigations?
Mm.
You'll be like, okay, we think the best option would have been IVF, but if you say you don't want to do IVF, maybe we could try this.
Oh, you maybe like IUI, is that what you're
Yeah,
saying?
maybe you or
Okay,
maybe
okay,
induce
okay.
ovulation or
In this
something.
of
Or
oh,
so
I
I think
see.
that's
So
where this
yeah,
person is coming
I think you
from.
should be the person's doctor.
Well, I'm just trying to relate with my viewers.
I think you're right, actually. Yes.
Yeah. Mm.
I've not done IUI in a while, so I seem to be forgetting about IUI. Yes, what they call artificial insemination, or we
Mm.
call it intrauterine insemination.
Mm.
They can induce ovulation, then get the sperms and put the sperm in the uterus of the woman.
Mm.
Yeah, so IUI, one way
Okay.
they can go about it.
Okay. And he
Yes.
also mentioned ovulation induction. So I
Yeah.
think at this point, if you really want to seek help outside IVF, just
Mm.
still see your fertility specialist.
Yes, and some people actually misunderstand the conditions where IUI should be done.
Done. Maybe
They
we
just
should
call
talk
you,
about
"Hey,
that.
Dr. Ken, um, I was referred to come to the clinic to see one of the doctors working with you, but I was asked to go for an IVF.
Mm.
But is there no way I could do IUI?
Mm.
You don't make such decisions.
Decisions. Mm.
If you have to do IUI, for instance, the fallopian tubes have to be okay,
Mm.
and then you have to have reasonable sperm counts,
Mm.
because the lower the sperm count, the lower your
Yeah.
chances of succeeding. There are
Mm.
some level of sperms that are not even okay for IUI.
IUI.
They're not
Mm.
even okay for IVF, just
Mm.
ICSI.
Mm.
That's the
Wow.
advanced IVF that they're good enough for. You see, so for you to do an IUI, you have to be ovulating, or you can be induced to ovulate. Your
Mm.
fallopian tubes have to be functional. You know,
Yeah.
and then the sperms have to be fair enough.
Hmm.
So when these conditions are okay, then of course you have good chance with IUI.
So hope that answers your question.
But
Yes.
can I just do an IUI first before IVF? Yes, you
IVF.
can if
Because they
conditions are
feel like it's
favorable.
less, even IVF is not invasive, but still they feel like IUI maybe is an easier way.
No, it's not costly. It's not too expensive.
Expensive.
Oh yeah,
Oh,
that's
I
the, I
get
think
the catch.
that's the
That's the
yeah.
reason why some
hmm
of them will opt for
But the
it.
prospect of achieving pregnancy is higher
Pregnancy.
with IVF than
IVF
with
than
IUI.
IUI. So hope you're able to also understand what Dr. Ken has explained. However, just in case you are in this category, please seek help from your fertility specialist and keep it open so you're able to embrace whatever
hmm
counsels are given to you, and then you
Sure,
achieve your dream babies. Okay, and then we have a question. Can a man with azoospermia have a successful IVF?
sure.
Okay.
Now it depends on what kind of azoospermia it is.
Okay.
It could be a obstructive azoospermia, in
Okay.
which case the man still makes sperms, produces
Yes.
sperms. You could get the sperms from the stores,
Hmm.
epididymis.
Hmm.
Just that the outlet for letting out sperms has been blocked. So for
Okay.
this kind of men, you could do a surgical sperm extraction.
Extraction. Oh,
Yes.
okay.
So while you get
Hmm.
the wife's eggs, you do a surgical sperm extraction,
Hmm.
and you use it to fertilize the
The
eggs. So
eggs.
that way they have good prospect of getting pregnant. But
Pregnant.
then it's okay to know that this sperm's been stored for a long time in these channels, and have
Hmm.
not been let out. They are exposed to high level of oxidative stress,
Hmm.
and so they could have higher DNA fragmentation
Okay.
than
Hmm.
when all things are okay. But in
Hmm.
any case, you could use those sperms to achieve pregnancy. So the other azoospermia is a functional
Hmm.
azoospermia where the body
Okay.
doesn't produce sperms
Sperm.
at all.
Hmm. Wow.
So in this case, you cannot achieve pregnancy. You may need to use the services of sperm donors
Don't know.
or
Okay.
of sperm bank,
Okay.
to achieve pregnancy.
Pregnancy. Wow.
And by
So
the way, it's good to mention it's an acceptable treatment option across the
the
world.
world. Hmm.
There are international sperm banks. There are
Hmm.
sperm banks everywhere,
Everywhere.
and sperms can be shipped from one continent to the other,
Oh wow.
just as you could ship oocytes, which are the eggs, female
Eggs.
eggs,
Yes.
or shipped embryos through the
Embryos. Oh.
cryo tanks
Hmm.
from one continent or
To
country to
another.
another. Okay, so they are standard fertility care.
Wow. Okay. So I hope that answers your question for this person that has asked this question. Viewers, keep your questions coming, and just in case we're not able to attend to your questions, you could just keep dropping them. Would either have attend to them via a private chat, but please keep your questions coming. So we have a question: is there an age limit for IVF?
Yes, there's age limit for IVF, and this
Oh,
is actually
okay.
determined by the region in
Okay.
question for
Hmm.
practicing.
Okay.
There's age limit for IVF. I think for this part of the world is about 50, 52
Oh,
as a
okay.
limit.
Okay. Hmm.
So it's not advisable beyond 50, 52.
Hmm.
Yes. So for some other countries, it's 40,
Oh.
late 40s.
Hmm.
When I was in the University of Warwick, 2013,
Okay. Hmm.
Center for Human Reproduction, I think then our limit was 50.
Oh,
Yeah,
okay.
our limit
Hmm.
was 50. I don't know what currently the limits are.
Ah, okay.
But then this is also subject to a whole lot of things,
Things.
knowing that some people can still be very healthy even beyond
Mhm.
50.
Yeah.
And we have seen people getting pregnant. I mean, in our own facility, even at
Yeah.
the age of 60, 63.
Wow.
You understand?
Hmm.
So, even though we will be shy to talk about it or to do that, but this were the practice those days.
Hmm.
But the bottom line is the health of someone. It's very important.
Important.
It's
Hmm.
very important.
Because they
You
could be
know,
young and not even healthy.
exactly.
Hmm.
The health is very important.
Hmm.
So everyone should be evaluated based on their merits. There are
Hmm.
ladies at 40 that should not be pregnant. There are
Hmm.
those at 20 that should
Should not
not
be
be pregnant,
pregnant.
shouldn't be
Hmm.
allowed to be pregnant.
Wow.
And
Hmm.
there are those beyond 50
That can
that
be given the
can be
chance. Hmm.
pregnant.
Wow.
So it all depends. There should be um, identified
Okay.
properly. Yeah, I saw a lady today. I saw someone today
Okay.
actually,
Mm.
in the clinics. She had delivered before.
Okay.
She had two cesarean section. The second
Mm.
cesarean section, she had a complication
Hmm.
that the wall of the uterus was attached to the bladder. So she
Hmm.
could actually pee blood through the uterus into the bladder and all of that. So the
My
separation was
goodness.
done,
Hmm.
corrective surgery, and yeah, she's okay. She's in her
Okay.
mid 40s,
Hmm.
and then she was referred
Hmm.
to have fertility care.
Hmm.
In fact, she was referred for IVF.
Oh, wow.
You understand? So when I
Hmm.
reviewed her, I said, "Come on, man, it's health at this point." That connection where corrections were made was very flimsy and
Hmm.
thin. I saw it was very clear on ultrasound.
Hmm.
So it means there's a weakness on the line, I mean, on the wall of
All
the
of the
uterus
uterus and the
anteriorly. So the
wow.
problem here is
Hmm.
if you transfer a baby into this uterus, for
Yes.
instance, that uterus may likely rupture.
Hmm. Hmm.
Yes. And so that's so much risk to
Risk,
take. And we talk
exactly.
about it right there, man.
Hmm.
Not safe. Go look at other options of getting babies, but getting
Hmm.
pregnant all by yourself with the corrective surgery you've had
Hmm.
and what we've seen on ultrasound scan and all of
Hmm.
that. So
That's so much of a
that's
risk.
so much of a risk to take. So in that
Wow.
case, you may want to think twice
Hmm.
before attempting
That's
pregnancy.
again.
Yeah.
So, bottom line, yes, age limits, but health
Hmm.
is
Very
priority.
important.
Yes,
Yeah.
is very paramount. Okay, so well, the questions are endless, and for the sake of our time, what would be your it's question and answer there, and I know questions would keep coming, but on a general note, maybe you should just give a little a counsel coming from a top word specialist like you. I think you should probably just give a little counsel to viewers with regards to fertility in general, or whatever related to do with a fertility specialist. And we have one of the world best fertility specialists with us. So I think you should give a little counsel to our viewers right now.
Oh, I think when it gets to issue of fertility, everybody's stories are different,
Mm,
and your peculiarity is yours,
mm,
and then you should be taken as a separate entity. Your concern should be discussed with your doctor directly,
yeah,
and he'll give the appropriate advice.
yeah.
So, but what I must say is, if you have opportunity to be pregnant, get pregnant early.
Mm,
You just get pregnant
it's
early.
early. Mm,
Yeah. If you do have opportunity,
too
get pregnant early. Then
early.
if you're not opportune, freeze your gametes and
Mm,
wait for the opportune
but
time to
in
get
time.
pregnant.
Wow.
Yeah. That's
That's
my advice. And just be safe.
yeah.
Just be safe. That's all. When you get to making decisions for pregnancy, just be safe.
Well, that's a very warm counsel coming from Dr. Ken. So, viewers, I hope you take this to heart, and I hope this touches somewhere so you're able to act on it. And we hope for the best. It's been very amazing having you, Dr. Ken, with us today.
Thank you.
I'm sure they had a good time as well. Keep your questions coming until we come your way next time. Have a lovely evening. Bye.